Welcome back, everybody. This is Pain Talk with Pain Consultants of East Tennessee. Our next question is, what are the new advances in pain as far as technology is concerned to help with painful conditions? Well, one of the big advances that I have seen and a lot of pain specialists have seen in the past several years is neuromodulation, and it also goes by the name of dorsal column stimulation or spinal cord stimulation. And spinal cord stimulation has been around for several decades, but it seems to be that the past 5 years or so there have been a lot of different advances that have changed the technology and that have improved some of the outcomes, at least initially, and we're certainly seeing that clinically. So for spinal cord stimulation, people that would be good candidates for spinal cord stimulation are those individuals that have had previous back surgery that continue to have low back and leg pain issues. And when I mean by low back and leg pain issues, I mean pain. So there's another condition as well, is complex regional pain syndrome, which is another painful condition that spinal cord stimulation can also be helpful for, and also peripheral neuropathies or certain types of neuropathic pain syndromes that can also be helpful for pain, or spinal cord stimulation can be helpful for those conditions. So what is spinal cord stimulation? Well, there's usually a 3-step process. Number one, if you have the condition that fits spinal cord stimulation, you will have to see a psychologist for a clearance. All insurances require that. Number two, there's a trial. So spinal cord stimulation is an epidural placement of 2 little wires. It's usually a 15-minute procedure. And during that trial, you have 5 to 7 days to see if the stimulation provided by those little wires are helping with your pain. Now, there are different types of stimulation: high frequency stimulation, regular tonic stimulation, and burst stimulation. At Pain Consultants of East Tennessee, I primarily use burst stimulation, where you do not feel any of the sensation of stimulation, but the pain goes away, and we're seeing upwards to a 90% conversion rate from the trial to the permanent implant. So if you do well with the trial after 5 to 7 days and you have significant relief of your pain, the next part is in the implantation of a small device about this big or so underneath the skin. It's kind of pacemaker sized device. It takes about 6 to 8 weeks for everything to heal, and this device can last several years, providing great relief for patients.